Well, hello. We're talking today with Katie
Hey.
Mitchell, Sinnissippi Center's behavioral health clinician, about how our current situation is affecting people and what they can do to take care of their mental wellness. Hello.
Hey, how's it going?
It's good. Good to join you by technology, which, as we said in our last video when I talked to Patrick, we're using technology to keep going and keep providing services for folks. So, but
Yes, absolutely.
let's get right into it. I often talk on the radio program when I do talk on the radio that we all have a level of mental wellness and we all have a level of physical wellness, and both are really being challenged right now. But however, and they're of course they're connected, the mind body connection. But obviously, what I want you to sort of address for us today, for the people who are watching, is the mental wellness aspect. So, what can people do to improve their mental wellness during the stay-at-home order and during the coronavirus outbreak? Just the average everyday person.
Yeah, so a couple of really great tips is maintaining any type of schedule. Any schedule that you can do is really helpful. Keeping meal times, keeping work times, even outside time when you can. The great thing about outside right now is we can definitely engage our senses in order to activate our brain and to send a direct connection to our brain to calm down. So you can use touch, smell, see, hear. It's actually called sensory grounding in our world. And that helps anybody just stay calm and stay active. The other thing you can do is we always want to maintain social distance, but you want to stay
Mm-hmm.
connected through FaceTime, video messengers, Zoom, text, phone calls. Connection is also really super important right now, just to help us feel like we're maintaining some type of connection with everybody. The
Sure.
last thing, what I've been doing with a lot of clients is actually this fun little gratitude chain. So
Nice.
a lot of people see these at Christmas time,
Right.
but this is really fun to do with your family. So each of mine have something that I feel grateful for. And so it definitely starts with a conversation. You can do this as adults or even kids, because we know when we really stay mindful and think about the things we're grateful for, it helps us just keep everything in perspective during this time.
Well, that's really great, and yeah, and everybody has something they could do. I doubt you heard it, but my coworker, one of my dogs, was growling while we were talking. I don't know why. Spending time with my dogs is something that I do. I also love music. I play my drums, grilling. There's all kinds of things that you can do. That a return to normalcy is big, isn't it? Right?
Absolutely.
As much normalcy as you can have in your life, and those are the things I love to do anyway. And I've been doing some of those as kind of my own way to help deal with this. But okay, so you mentioned the chain idea. Where can people go for resources, for ideas, to talk about some of these things? We only have a short period of time. There's a lot of things that you can do to deal with this. Where are there good resources?
The one I really wanted to hit on, that Illinois just launched, which is completely free, is Call for Calm. So it's call the number four for calm. And you can text talk, TALK, to 552-020. And you're able to gain that support for stress, mental illness, needing to talk to somebody. What's really great is this service is also offered in Spanish. So you can
Nice.
text um, hablar, excuse my Spanish, I'm not fluent, but hablar to 552-020, and they're able to provide all that service in Spanish as well. The other thing I saw was that it really gets personal. So you can text unemployment, food, shelter, and then they're really able to provide that personal one-on-one services of what you're needing at this time. So I really like to highlight this right now because
Sure.
it's not only just for people that are connected with Sinnissippi or
Mm-hmm.
other mental health agencies, but it's for anybody to use free of charge. Obviously, there is our always our crisis services through Sinnissippi. Those are still ongoing and running 24 hours a day, 7 days a week, if you're needing to connect to a mental health counselor at this time as well.
Very good on that. And if I may give us a plug a little bit, we've collected from clinicians like yourself. I didn't do all the hard work. You sent me some things to put on our website. We have an extensive links page where you can find just things like sites to go to stave off the boredom for you or your kids. We have other resources there. We have even some resources for mental health professionals. We have local resources. There's all kinds of things there. And that call to com is at called for com, sorry, that Illinois just put out is actually at the top of that links list as well. So you can go to sinnissippi.org/links and you can see all of those as well. So I guess my final question, sounds like your coworkers are doing something in the background
Yeah.
too.
Yep.
So the last question would be, especially since it's Sinnissippi Centers, we're a behavioral health care provider, how are people that already had a mental illness, a substance use disorder, any other behavioral health concern, how are they impacted more by this? And what, in particular, probably since everybody's at home, what can family members do to help support them and help take care of them?
So what we've seen at this time, unfortunately, right now is having the isolation, sometimes the loneliness that this can bring, can really intensify symptoms or behaviors or emotions for people, which can get very scary. And so I think as things feel a little bit more intense and a little bit more vulnerable, the way we can support each other, there's a couple of really unique, fun things I've seen come across social media. One of them that was this idea of a green, yellow, red system for your window. So if you're somebody that's needing that connection, you put a color in your window, and then that allows people to safely see where you're at or connect with you. So obviously green is meaning, I'm backwards. Green is meaning I'm good, I'm doing well, things are great. Yellow is meaning I'm probably feeling a little low right now, needing that extra support. If you can reach out, a phone call, a FaceTime would be great. And then red meaning, 911 danger, something's going on, I'm in crisis. And so I really like this idea because this was really simple to make. Just piece of paper, some crayons, if you have construction paper. The other thing I think is just everybody's feeling vulnerable at this time. So being empathetic to others, being understanding, being kind, that can always help support everybody during this time of need. But yeah, some of those creative ideas of connecting, doing the hearts in the window I've seen, doing the color system, all can be great tools to use just to support one another during this time and to connect with people in a safe way.
Yeah, and a lot of the support meetings, like what we're doing now, we're both working from home. We're using technology. A lot of the support meetings have gone online in this way using technology and maybe even everybody at home. So there are some support meetings that are online. Again, those links are on our webpage as well. But some of that's being done online now rather than so that it can continue. So those support meetings can continue and support groups can continue.
Yes, absolutely. There has been some great AA meetings going around, different through the local hospitals of different types of support groups, even through Sinnissippi, our own adolescent school groups, adult mental health groups have been occurring. So everything's been continuing to keep everybody connected and supported.
Well, thank you so much for joining us. It's great information, and and Sinnissippi, as we said in another video, continues to operate. We're using technology like you and I are doing now and like you said, to continue to provide services, and it's a needed thing. And we thank you for doing what you're doing as an essential worker. We thank you for that as well. So thanks for joining us.
Yeah, thanks, Andy.
Yeah, thanks for joining us today. Take care.